Hey guys, we're Arushi and Firas, two graduate students at Johns Hopkins, driven by our shared passion for healthcare and a mission to demystify the complexities of the US healthcare system. Welcome to Decoded Healthcare, a podcast where we break down what's happening in the healthcare industry currently so it's accessible and easy to understand for everyone. Our main goal for this podcast is for everyone to be able to learn about the fundamentals of the US healthcare system and what trends, policy changes, market developments, or news topics are occurring that could have any impact on your health. We know there's a lot going on out there, and we hope to serve as a resource that breaks down the complexity that is our healthcare system in an easy to understand way. Now, today, for our first episode, we'll walk you through the basics of how the healthcare structure in the United States works and the three major players of the system, and how you, as our patient, will interact with each of them when you receive care on a daily basis. First, let's get into some quick facts. At its core, our current US healthcare system is built on a mix of public and private insurance, making it one of the most complex in the world. And that complexity comes with a huge price tag. The US spends more on healthcare than any other country, spending over $4.5 trillion a year, which accounts for nearly 18% of our nation's GDP. That's more than twice the average spending of other high-income nations. Despite this massive investment, the US still faces challenges and outcomes. For example, life expectancy in the US is only around 77 years, which is lower than in many other developed countries. The US also has the highest rate of avoidable deaths among peer nations and ranks poorly on measures like maternal mortality and chronic disease management. More than 330 million Americans rely on a patchwork of insurance options. About 49% get coverage through their employers, while 21% are enrolled in Medicaid and 14% enrolled in Medicare. Around 8% of that population remains uninsured to this day, which is over 27 million people.
Now, to truly understand how all of this functions and why navigating it can feel like learning a second language, we need to start with the three key players. There are three main entities that make up the healthcare system in the United States, and these are providers, payers, and the life sciences. Providers are the people that are delivering that direct patient care. Think about your doctors, nurses, physical therapists, PAs, dentists, and other healthcare professionals. In 2025, there were over 1.1 million physicians and more than 4.9 million registered nurses in the United States. And these providers work as care deliverers. They are usually employed by major hospitals or hospital systems and the ones that you directly work with when you go into the doctor's office. Now, let's move on to the payers. These are the people behind the scenes that are footing the bill and paying for the treatments and expenses that the doctors provide and deliver to you. Payers are your insurance companies. And to keep it simple for this episode, we're going to group them into three categories: government insurance, commercial insurance, and private insurance. Government insurance includes programs like Medicare and Medicaid, which are funded by taxpayer dollars, and nearly 66 million individuals are covered by Medicare, and 71 million are enrolled in Medicaid as of today. Next are commercial insurance, which are publicly traded companies that offer insurance to individuals either through their employers or for individuals to purchase themselves. Think about United Healthcare, Aetna, and Humana as your big commercial insurers. Lastly are the private insurance companies that are not publicly traded, but like commercial insurance, they offer coverage through employer programs or for individual purchase. Think about Blue Cross and Blue Shield. And finally, the third major player are the life sciences industry, which include pharmaceuticals and biotech companies that develop and manufacture medications and medical technologies. Think about all the vaccines you get, all the medications, and all the medical devices and machines that are used when you would go into the doctor's office. These are your life science industry companies at work. In 2025, the US pharmaceutical market was valued at over 690 billion, and it had accounted for nearly 40% of global pharmaceutical revenue. Companies like Pfizer, Moderna, and Eli Lilly fall into this category and are especially well known after their roles in the COVID-19 vaccine rollout.
Now, let's think about the most important aspect of our system, you, our patient. So, how do all these groups work together? The providers category, the payers category, and the life sciences category. And how do you, as a patient, fit into all of this? We think it'll be helpful if we walk through a typical scenario of a patient seeking care to illustrate how these entities interact with each other in real life. Let's say you've been experiencing symptoms that you suspect are related to a chronic condition. Maybe something like diabetes. You schedule a visit with your primary care provider. That provider, which is a member of our provider category in our healthcare ecosystem, examines you, runs some tests, and confirms the diagnosis as being diabetes. Now, this visit and the tests involved are not free. That's where the payer comes in. To clarify, payers are not paying for the doctor's salary. Rather, they are working to help you pay for the medical tests and medication that your doctor has provided to you. If you have private or commercial insurance through your employer or individually, your insurance company reviews the claim and decides how much of the cost they'll cover. These insurance companies take part in what is called cost sharing, where they pay usually for the majority of your visit, but you have to pay for a small portion of it. Cost sharing can take a couple different forms, such as a copay, coinsurance, or out-of-pocket costs. This is why when you go to the doctor, you usually have a small copay to pay upfront. If you're on a government plan like Medicare or Medicaid, a similar step occurs, but this all just happens through publicly funded programs that are typically backed by taxpayer dollars. To manage your condition, your provider may prescribe medication, perhaps insulin in the case of diabetes. This is where a life science company enters the picture. A pharmaceutical company develops that insulin, and now their product is being sold and distributed through a pharmacy, such as CVS, Walgreens, and other big names. These pharmacies work with your insurance provider to determine your out-of-pocket costs, which again is a form of cost sharing placed by the insurance companies. As of 2025, the average monthly out-of-pocket cost for insulin is around $35, thanks to recent federal caps for Medicare beneficiaries. Throughout this entire journey, the patient, which is you, is at the center of everything. You're navigating appointments, insurance approvals, pharmacy visits, and you're managing your health while doing all of that. And behind the scenes, there's a web of policies, reimbursement negotiations, and data sharing happening between all three major entities.
Now, we want to clarify that this is a hyper simplified example of a patient journey. There's a lot more that goes on behind the scenes between these players to bring you the care you receive. Insurance companies, life science companies, and providers are constantly talking and negotiating to create deals to bring you the care. But this highlights a huge factor of the US healthcare system in that it's fragmented. Care is not delivered by one unified entity. Instead, it's collaboration, sometimes smooth, sometimes chaotic, between many organizations that may not always be aligned in their incentives. For instance, nearly 25% of healthcare spending goes toward administrative costs toward these relationships, which is significantly higher than in any other developed country. But this complexity also means there's room for innovation. Across the country, there are efforts to create more coordinated care models like accountable care organizations known as ACOs and value-based care programs, which now involve over 13 million Medicare beneficiaries. These models aim to streamline communication and then reduce the unnecessary spending and improve outcomes by tying provider payments to the quality and not just the quantity of care that's delivered. We'll go deeper into these recent innovations and the progress being made within our healthcare system in future episodes. But for today, we wanted to give a very, very quick and simple overview of the system to set a foundation for future episodes. So thanks for tuning into this episode of Decoded Healthcare. If you found this breakdown helpful, subscribe and share it with someone who's just as curious about healthcare really works as you are. Until next time, stay informed and stay well.